So, dear colleagues, welcome to this press conference to go over the situation of COVID-19 in Quebec. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier. First, hello everyone. Hello to journalists and people listening to us. Before talking to you about the numbers today, I want to talk to you about the elderly. We've been saying it since the beginning. The elderly are not at more risk than others of getting the virus, but they are at greater risk than others of having serious consequences if they catch the virus. And if we look at the death toll that we have in Quebec, 89% of the deaths are of people who are 70 and over. So we can really see that we truly have to bring specific attention to this, whether it be the elderly who live in residences for the elderly or the elderly who live alone at home. And we've said this since the beginning. So it's important to keep one's distance, but it's also important to keep oneself aware. And when there are problems, yes, there are transfers being done from CHSLDs to hospitals, and when there are any difficulties, so from homes to hospitals as well. So it's important, first of all, in the homes for the elderly, I would like to remind you that we very quickly took pretty strict measures. Remember, at the beginning, we immediately banned visits. We immediately increased the budget by 133 million. And we are, right now, because there is fewer people as predicted in the hospitals, so we are going to take a part of that staff, both nurses and doctors, and send those people to CHSLDs and residences. And later, Danielle will be speaking about this, and she's going to talk to you a little bit more about the numbers, you know, how many people, and what the plan is. And what's important, which is something that we already started, is we're going to systematically be testing every CHSLDs to know whether they have the virus. So the employees as well as the residents. So we'll be testing everyone to know properly what the situation is and to be able to follow those places where things are more difficult. So Danielle is going to be talking to you about the residences for the elderly later, but I still want to come back to the guidelines for the elderly who live at home. It's important. Ideally, no contact, so we ask them not to go out. We are also asking those who take food to them to keep 2 meters away from them, to not take advantage of the fact that they're there, you know, to start chatting. You can do that over the phone after. So it's really, really important to keep that distance. The last thing that we want is for people over 70 years of age to catch the virus. So let's keep that in mind. And it's true for Easter. So I'll be the first, you know. I'm used to every year, it's like Mother's Day. At Easter, I would go to my mother's, but now I'm not going to go to my mother's. I'll be calling her on Sunday, of course, but I won't be going to see her. So I want us to mobilize ourselves, all of society, all Quebecers, to do everything to protect our elderly. That should be our priority mission in the upcoming days and weeks. So, the numbers for the day. Unfortunately, 25 new deaths. We are now at 175 deaths. Of course, I wish to offer my condolences to those families of the victims. We have now 10,031 confirmed cases, an increase of 691. 632 people are being hospitalized. That is an increase of 49. And out of those 682, there's 181 people who are in intensive care. So an increase of only 17. And I wish to tell you, yes, I have to cough in my elbow. I'm sorry, next time. I wish to tell you that it's been a few days that we've been seeing that it's really stabilizing. in terms of hospitalizations. That really, truly is good news. That means that we are starting to see the light at the end of the tunnel. We are starting to, if it continues this way, we are starting to win that fight that we're waging, which is encouraging, and which brings us to start preparing the next steps, that is the reopening of stores and businesses. But I just want to tell you, we're not there yet. We still have to keep seeing these kinds of days as we've had in the past few days, when there's no big increases in the number of hospitalizations and a number of people in intensive care, which does not prevent us from preparing ourselves. And I wish to perhaps talk to entrepreneurs, to owners, to managers of businesses, to explain to you the discussions that we are having with public health. So first, of course, when we reopen businesses, it will be very important, first of all, to concentrate on those businesses where people really can. And here, I make a call out to the responsibility of owners and managers to remain 2 meters away. Employees have to be able to, at all times, being 2 meters away from their colleagues and 2 meters away, if that is the case as well, from clients. That is going to be a very important criteria. And the 2 meters, get used to it in Quebec. That's going to last months. So in the next few days, next few weeks, we're thinking about reopening businesses, but the guideline for the 2 meters will remain for months. So get used to that guideline. Of course, as well, when we're thinking of reopening businesses and stores, well, of course, that also will have an effect on daycare. Of course, it's difficult to respect the 2 meters in schools and in daycare, so we have to ask ourselves questions. If we want workers to go back to work, well, what happens with the children? What is going to happen with public transportation and rush hour? So we're going to be asking, in the next few days, we'll ask employers to see how we could be more flexible with schedules so that not all workers use public transportation during rush hour, in the morning and at the end of the afternoon, because we don't want, of course, for people to be all in a bunch in the trains and metros and buses. So it's just to show you that it's not that simple. I'm seeing certain comments of people who are saying, well, all businesses that are 2 meters away should all be reopened tomorrow morning. Yeah, okay, what are you going to do with the kids? What are you going to do with the employees who need to use public transport? We have to take precautions. So yes, I'm optimistic that we'll be able to, in the next few days and weeks, to start reopening businesses and stores, but we have to be prudent, and we must make a call out to the responsibility and accountability of employers. And the numbers have to continue stabilizing. And for those numbers to continue stabilizing, we have to keep working hard. I know that we're asking a lot of Quebecers, but it is important to remain disciplined. I wish to now get back to the scenarios that were presented yesterday by the experts of public health. For me, there's two data there that is very reassuring. First of all, the projections on the number of hospitalizations and the number of people who would be in intensive care depending on the different scenarios. You saw that in intensive care, in the most pessimistic of scenarios, which is that of an Italian style or a little bit like what happened in Spain, we would need 1,000 beds with ventilators in intensive care. And that, if it's necessary, we have it. We don't believe that it will be necessary, but we have that capacity of having 1,000 beds with ventilators if the pessimistic scenario were the one to take place. So that is very good news that we got yesterday during the presentation. The second good news that we got in the data that was presented yesterday is to see that up until now, our scenario, that of Quebec, is a lot closer to that of the best countries, such as Germany, as opposed to the countries where there were more deaths. And that we this is due to Quebecers respecting guidelines. So I think that we can be proud of the results that we've had up until now, while saying, let's not stop. We started really well. We are heading the right way. The daily thanks. I wish to give those thanks to all those people who are working in CHSLDs and the residences for the elderly, whether it be doctors, nurses, attendants. I know that the situation is hard, and I just want to tell you first, courage. Reinforcements are coming. And I also wish to say thank you so much for your devotion in circumstances that are very difficult in CHSLDs and residences for the elderly. So a very special thank you today to all those who work in those residences. And I'd like to end by perhaps concentrating on the 2-meter guideline, because each Quebecer is going to have to visualize themselves in the next few weeks and months of always staying 2 meters away from other people. So, of course, this is a new culture. So, we can't shake hands, we can't be too close to other people. So let's try all together to start visualizing this. That for a certain number of months, this is how it's going to be. We're going to be staying 2 meters away from other people. So I would like to conclude by saying the last few days' data make me optimistic. We're starting to see the light at the end of the tunnel. We are starting to win that fight together. I'm very proud of the work that has been done by Quebecers who have been unified since the beginning. We just have to keep working hard to make sure that we can start getting out of this crisis and that we can see to the beginning of a more normal life quickly.
Good afternoon. Since the beginning of the crisis, we know that the most vulnerable to the virus are the elderly. We concentrate our efforts in our residences for seniors. But it's also very important that you all stay at 2 meters or 6 feet from each elderly. We're also already working with our public health experts to prepare the gradual end of the economic pause sooner than later. But we have to make sure that we restart the economy without restarting the pandemic. So I know it's tough to continue all our efforts, but as we say in English, April showers bring May flowers. It's from Félotier, by the way. So thank you all. And je veux maintenant passer la parole.
And I now wish to hand over the mic to Daniel, who is going to be talking to you about the plan for the residences for the elderly. Thank you, Mr. Premier. So the Premier just spoke about it, and I can tell you that I have very frequent contacts with my colleague, the Minister responsible for the elderly, Ms. Marguerite Blais, and that both of us are concerned by the situation in many CHSLDs and residences for the elderly. We've been saying it since the beginning. Our priority mission is to protect the population in its entirety, but particularly our elderly, and no effort will be left aside. And we've done a lot of concrete things in the past few weeks. For example, the 133 million to support the private sector, and that is being used right now to add staff and also increase safety and security measures and protective measures for our elderly. We're also distributing protective equipment in all CHSLDs and residences for the elderly, and we are screening as a priority and systematically in those places where the elderly live and where they are vulnerable. And we're saying right now our hospital centers are taking charge fewer infected people than what we had predicted. And that's good news because the vast majority of people don't need to be hospitalized. So that is good news. And that shows, as we've been saying for some time, that our efforts as a population are very fruitful, and we're very full of gratitude for this. So we're experiencing a situation that is better because of the efforts of our population. But that also gives us some leeway, and that is why this situation has brought me to contact many of our partners. So first, as I said at the beginning of the week, I spoke with the managers of all establishments in Quebec. I spoke with the federations for specialists and family doctors. I also spoke with the Interprofessional Federation of Quebec, so nurses, respiratory therapists, so that we use the resources in hospital settings, that we take them and bring them to CHSLDs and other places where people live. So that's ongoing right now. We're speaking of 450 doctors that are going to go immediately to those places. There's also going to be nurses. The president of the FIC was confirming it to me. Attendants that are going to come as reinforcements, as well as managers and administrators. So we launched a call through the initiative I Contribute, Je Contribue, you'll recall, and we convinced 500 nurses to re-register in the Order of Nurses of Quebec. So that is an operation of redeployment, which is massive, which is being done right now, and that will allow us to have teams, and that is fundamental in the present situation, teams that will be dedicated by establishment and by unit. And that is also fundamental, that it be the same people who intervene with our elderly per unit and per establishment, per zone, cold zone and hot zone. And that is why we have to add staff in order to give ourselves the possibility of having these dedicated teams. It's going to make all the difference. So it's being set up, and it's already even finished in certain CHSLDs, particularly the ones that are already experiencing outbreaks. So we're also going to be doing systematic screening tests of the elderly and the staff in CHSLDs and in other residences. So that is a very important measure. We want these places to be safe for residents as well as the staff. And I will end by saying a word on families. The families of these people, we're not forgetting you. We know that you're worried. We want to reassure you. And we also want to make sure that you are informed in a sustained way of the health of your loved ones. So that is the word of the day that we've given to all CHSLDs, to call the families, to make them aware of what is going on as far as the health of their loved ones is concerned. So what I want to say to end is that we want to protect our elderly, and we want to protect those who have built our Quebec. This is a fundamental value for us, and we are going to do everything to protect our elderly. Thank you. Thank you. So we have about 20 minutes left for the question period. So please limit your interventions. Concerning the specific situation of the Sainte-Dorothée CHSLD in Navan, we've heard some troubling allegations emerge in the past few hours. Some union representatives saying that employees had symptoms, that they had told their employer that they were still required to go to work. People evoking a lack of equipment. A nurse who was saying on social media, having been sent as reinforcement, but that when she arrived, she wasn't trained, she wasn't helped. Is that situation normal? There are specific measures that should be applied in that specific CHSLD. Yes, in fact. And I think that Dr. Arruda is going to be speaking about epidemiological investigation that will have to be made. I'll give him the mic right after, because it's very important to see what happened in that CHSLD in Laval. But right now, and it started since the beginning, we've added staff. We added 70 people to that CHSLD, nurses, attendants, managers. So there's an entire additional team that came to give a hand to this CHSLD Nava, because that's what we have to do. As I was explaining a few minutes ago, we have to add staff to be able to dedicate some teams to each unit, because people can't go from one establishment to another. And that's what we're doing right now at the Laval CHSLD. But as far as the situation that took place, I said it in the past, and it's still the same guideline. People who have symptoms cannot go to work. If you have symptoms, you don't go to work.
Peut-être un peu pour documenter la situation, premièrement, il faut comprendre.
And to document the situation, it has to be understood that there's also a notion that is pretty recent that had been given as a hypothesis, but people who are asymptomatic, who might have the disease, there are even elderly who might be asymptomatic, and they were tested and they showed positive. First, what I want to say is it's clear that we're going to be sending an investigation team to review everything that happened at that particular place. What was the first case? Who were the health workers who were present? Do what we really call an epidemiological investigation to know what happened here. But while awaiting to finish this investigation, actions have been set up to manage things. I do wish to report, and others have said it, it's not because you are infected at a certain age that you're going to die of this disease. Don't think that everybody who was in a CHSLD and infected with a positive test, that all those people are going to die. Very few people who die, unfortunately, are people who already have underlying conditions. So by testing everybody in tests, it is going to allow us to better estimate what the risk is to people and what are the conditions that are going to make that certain people die and others not. We know that age is an important factor. We know that comorbidities are important. So all that to say that basically we're setting up the measures independently of the investigation. We're doing that. But we will be investigating on that episode in particular and others if there's other cases in Quebec. We've heard more generally about CHSLDs that some doctors who practice in those establishments in the past few hours have been said that in certain cases it's better to prepare yourself psychologically that, there's going to be important deaths coming because the infection is already there. Do you share that concern? Well, of course, we can see the situation. What we see in the proportion of deaths, it's close to 50% of deaths. It's close to, we now have 175 of them. So these are people who were in CHSLDs. So that is what we've been saying today, and that's what we've been saying since the beginning, and now we're enforcing it even more, is that we want to protect these people, but we also wish to protect the staff, both, and we want to support our staff. I understand that the staff is concerned, and that is why we're saying that we're going to be moving teams that come from other sectors in a significant, massive way so that they come and give a hand. We also wish to support them with nurses in infection prevention and with multidisciplinary teams. So what I'm saying is that the situation is something that we are seeing too, and we're going to make sure that everything is done in order to get the best possible organization to protect our staff and especially protect our elderly. And also to reinforce what the Premier said, we have 25% of people who died who were at home. So, of course, in CHSLDs, we have a concentration of people who are very ill, who are at risk, and that is where the main outbreak is, But there is a quarter of those people who are at home. So visits to parents over the weekend, not Mother's Day, but, Easter, avoid that, because some people could be made very fragile. Ms. McCann, you were talking about 450 doctors who are ready immediately to go give a hand. How will these resources be deployed in the network and using what priorities? Are CHSLDs going to be prioritized or residences for the elderly? How will the places be chosen? Where will resources be sent first? Well, we're going to make particular effort for CHSLDs, but we're not forgetting the residences for the elderly that are more autonomous, what is called RPAs, and intermediary resources and family-type resources. We have frequent, sustained contacts with RPAs and RIRTF by our Doctors at Home team, and it's very important to support them. All of those resources who have fewer means, and that is why we invested $133 million to add means. So we're going to be making sure that there are nurses linked with those resources to ensure that everything is being done correctly as far as the prevention of infections is concerned, because a lot of efforts are being made by the people on the premises, but we also want to make sure that there's more staff, and we want to help those resources find staff as well. So we really wish to help every place where our elderly live. What is the plan for residences where there's no eclosion right now? No outbreak. What is the strategy, taking into account that our resources are limited and our equipment as well? First, as far as the equipment is concerned, because I didn't mention it, we're going to make sure that everybody has the procedural masks that are necessary. We're already making sure, and I reviewed everything with the Deputy Minister. Everything is being done so that the staff has the procedural masks, and our situation is improving as far as the availability of that material is concerned. So we want that everybody has them and know how to use them. So as far as CHSLDs are concerned, the deployment is going to take place certainly to CHSLDs where they're out. There are outbreaks. We have to go there as a priority. We're already there. We're going to be adding staff. But we also have to do it in other CHSLDs because we have to do preventive work. So what I'm saying today is we're going to be adding staff in all CHSLDs because we have to prevent. We have to organize everything so that the same team be dedicated per unit and certainly per establishment. So to forestall things. On the same topic, because there's questions on the part of all the healthcare staff, when is that going to be done, and the skills that are going to be required, because there are people who you're transferring who don't have the skills to work with the elderly. You talked about equipment, but it would seem that that's not quite available yet. And our CHSLDs and residences for the elderly, are there our cruise ships right now? It is our priority, our mission, CHSLDs and the residences for the elderly. So once again, we are making sure that everybody has the protective equipment, and we are going to be deploying the necessary number of people to staff all CHSLDs. And we are calling out to people who come from the network, yes, who are trained, yes, but we're also going to be calling out to people who are not necessarily trained specifically for care to the elderly, but that can do other tasks. I think that it is certainly possible. Since the beginning of the crisis, we've been pretty creative, but we are going to be, of course, putting people in safe situations. We're going to have well-trained teams who are going to be coaching, who are going to make sure that we do things correctly. But we're also going to call out to people that don't have specific training to intervene with the elderly. It's necessary to do that now, and they're still going to help a lot. The Conservatives, Mr. Legault, want to go back and sit in the House of Commons. They're making an adoption for the adoption of wage subsidies to companies. Do you fear delays? Well, that is an issue that is up to the federal government. I think that everybody must understand the urgency of helping individuals as much as companies. So I trust the good judgment of all political parties.
Bonjour à vous. D'abord, une question pour Dr. Arruda.
A question for Dr. Arruda. We've heard that the curves are encouraging, that the numbers could send us towards a nice season. What is the summer going to look like? People who perhaps want to go to parks and want to go to terraces. If this keeps going on, is that going to be possible? What about vacations? Well, you heard what the Premier said. That is that, yes, we're going to be giving hope. And yes, we have to start with our activity because we can't, stay confined ad vitam aeternam. But the question of 2 meters is still going to remain an important element. Intensive gatherings are going to remain problematic because as long as we don't have more information on what the proportion of people who are immunized is, we are at a risk of having these outbreaks reappear. So we don't want to end up with this situation where in the fall we have to confine people again. So we're going to reopen things progressively, trying to not, take any steps back. But we're going to need rules for entrepreneurs, for cities, for all businesses, etc. So I think that we're going to have to live differently until we believe that the virus will not reemerge. A question for Ms. McCann. We've heard that a lot of owners of residences for the elderly in many regions of Quebec, these owners have set up very strict rules, a protocol, so that the professionals who come on the premises to render services must go through a sort of screening process. They have to put their personal effects to the side. They have to sign something, but there's a lot of attendants and services at CHSLCs who refuse to follow that because they say that they did not get any guidelines from the CIUS or any others to comply. So they don't want to comply to those rules that have been set up by residences where there's no cases right now. We don't wish to import them. Well, I will say, first of all, that I salute the residences for the elderly who are mobilizing themselves to really ensure that it be an environment that is very protective. And I'm taking note of your comment. I hadn't heard about that yet, but that is what the importance. You know that in each region of Quebec, we have a link with the residences for the elderly. What is what we normally do. But if there is this kind of situation, I am convinced that we will find a way of agreeing to do things properly. So I'm taking that comment to heart, and we will have a follow-up with the people from the different regions to make sure that we have the same orientation. But once again, I salute the residences that are taking every precaution. You said that the guideline of the 2 meters is going to be around for months. Does that mean inevitably that schools will remain closed? Well, it's part of the discussions that we're having right now. Of course, 2 meters from the elderly, that for sure. Ideally, 2 meters from all people. So that presupposes asking ourselves questions, whether it be for daycares or schools. So there may be a gradual recovery, but we will take into account those kinds of questions of the 2 meters in schools and daycare centers. There are people who were having homes built, who were supposed to move into new homes, and who will end up in the street with no roof over their heads. Will residential construction, in certain cases, could it become an essential service, and could it start before the 4th of May to avoid people, ending up on the street? Yes. I think that over the next few days or weeks, it will be possible to resume residential construction. It would also be possible for a lot of companies to fill that accumulated delay on the construction of certain homes over the course of the past few weeks. So I'm optimistic for the construction sector. Of course, I need Mr. Arruda's okay, but I'm very confident. Hello, Mr. Premier, Ms. McCann, and Mr. Arruda. My question is for Dr. Arruda. What happened at L'Île Verte for you to send a pretty strict letter to the mayor, Ms. Newberry? First, you imposed total confinement of L'Île Verte, and you said our prior discussions and the assurance that you had given us that the residents of your municipality would comply with our orders, but the evidence that we've seen that it's not being respected, what happened there? Well, my objective is in priority to preserve the city and the health of those people who live on that island who are, older, and the essential workers who go there by helicopter to be able to help if ever there's an incident. We have to be able to transport people adequately. I had ordered a certain control together with the transportation of individuals to avoid that people who are outside of the island to come and contaminate the island because it would have acquired the disease outside of it. There were people who crossed the river with their children on boats in the morning, at night, which could have brought prejudice to the very children and those people. And we didn't have much collaboration from the municipal authorities to respect those guidelines, which forced me to go to confinement, which will allow the police now to avoid those kinds of things. So it's much tighter restrictions. I cannot allow that people in this city or on that island fall ill or die by taking these makeshift boats like this. I even have pictures of people who arrived very late at night and who entered the island. So in that context, I ordered the confinement of the island. Was this a delinquent municipality, in your opinion? Well, they extended the definition of people who were residents. You know, it was really funny, the quantity of people who suddenly became residents according to orientations that we had not granted. And I took that decision, taking into account people who do the transportation, you know, the workers who do that, but also the public health director of the region, of the Bas-Saint-Laurent. Hello. There are many festivals and large events that have already been cancelled for June, July, and August. Others not, like La Saint-Jean-Baptiste, the Festival d'été. Will public health order the cancellation of these events? Well, what I would tell you, generally speaking, I'd like to come back to the 2-meter rule. It would be very difficult in a festival, an event where there are hundreds and thousands of people, to respect the 2-meter rule. So, you know, as of the fact that we say that the 2-meter rule is going to be extended over a longer period, it is, in fact, highly unlikely that these kinds of festivals will be able to take place this summer. Dr. Ruda, do you have the breakdown per age group of the case of hospitalizations and intensive care, maybe? Yes, we have them. Hold on one second. I just want to check whether I have for the deaths as well. Sorry, I just have so many charts that sometimes I get lost, and I wasn't quite expecting that. But could I give you the information after, you know, so that we can... And I will also refer you to the specific place in the website. Well, it will be written at the National Institute of Public Health. I just don't want to, you know, spend too much time looking through my charts. But, you know, for the next press conferences, I'll make sure that I have the information on a sheet apart. All right, so let's continue. I would need a specification concerning the 2 meters this summer. Does that mean that we're going to have to remain 2 meters away from our loved ones all summer? You know, so dinners with people who are not part of our family or immediate family. So, well, we're not there yet. That's part of discussions, but I'm going to tell you that this is something that is being considered. This is an important condition in the short term, in the next few weeks, if we want to be able to have a normal life again in the next few weeks. We'll have to respect the 2-meter rule. At what moment are we going to be able to put it aside? Well, that will also depend on the evolution of the crisis over the next few weeks and months. So it will have to be evaluated according to how the number of people who are invented over the next few weeks and months evolves. What about tourism? Must we exclude any travel to other regions of Quebec during the summer? What does that mean for camping in national parks, fishing and all that? Well, once again, I think that we have to make a distinction between now, the next few weeks, where we wish to continue not having people move around. And once we get to the summer, we'll see what situation we're at, and we'll be able to evaluate it together with public health.
Merci. Oui, allez-y.
So, 4 age groups of hospitalizations, that's what you wanted. 7th of April. We'll go by percentages, and I'll be able to give you rates as well. So, the highest rate is 1.8 per 100,000. So that is 81 years of age and over. Then the second one, in terms of rate per 100,000, I would even say 41 to 70, who are hospitalized the most. So 40% of 41 to 70 years of age, and then we're at 27% for 71 to 80, 24% 81 and over, 19 to 40, 4.4%, and there's a proportion that is unknown. So what that means, generally speaking, the people who are the most hospitalized are those who are between 41 and 70 years of age. And let's hope that a good proportion is going to get through it all. But there are still, I would say, close to 50% combined will be 71 and over, including the group of 81 and over. Very well. Something new today. We're going to be taking a question that was sent to us by Twitter through La Presse from a media that doesn't have a parliamentary correspondent here at the National Assembly. Today's question is from Martin Bustil. In the exceptional measures, are you considering allowing municipalities to give a tax credit for companies that are closed during the confinement period? Those municipalities, will they be authorized to produce or to file deficit with budgets with a deficit at the end of the year? Well, we're not there yet. We're going to have to think about it with all municipalities once we are more advanced and closer to the end of the crisis. You know, what part will be compensated by the Quebec government, what part will not be. Of course, it will have a direct impact on tax accounts, so we don't have the answer to that question, unfortunately. Thank you. That completes our French language questions. English now.
Good afternoon. I have many questions about seniors, CHSLDs, the situation in Saint-Dorothée. So what is the government doing to tackle the problems in CHSLDs, especially with the Saint-Dorothée case, to make sure that we don't have a shortage of staff anymore?
Yes. What we're doing is we're redeploying staff that is in other sectors of the health system, because we have a good situation right now in our hospitals, thank God, because the population has helped us in taking all the measures we've put forward. And so we have a good situation, so we're going to redeploy those staff. We're talking about nurses, we're talking about orderlies, that will come to give a hand. It's already started. In Laval, they added 70 people, 70 staff members, in addition to the ones in place. So we're going to do that in all the CHSLD, not only those who are in éclosion, which are those that have more cases, but in all the CHSLD of the province, because we think that we have to really reorganize that the same staff is taking care of people in one unit versus another one, and the staff has to be in one establishment, not many establishments. For that, we need to add more staff. So that's what we're doing right now, and we're going to have also physicians coming to help us. We have almost 500 physicians, family doctors, who are going to help us all across Quebec to give more services in the long-term facilities. So we're going to reorganize in that way and protect the staff, protect the seniors. What we're saying also is that all the protective equipment has to be in place, and it's being done right now. It's been done for a while. If there are places that there are problems, we want to know. And we're telling the PDG, the Director Generals, that they have to provide, because our situation is better for the masks now, all the masks necessary in the long-term facilities. And we're going to test everybody. We're going to test the seniors. We're going to test the staff to make sure we know exactly where people have the COVID-19 and where, because you know that we organize the services in the long-term facilities between cold zones and hot zones, and even in between zones for people who have the COVID-19, those who don't have it. So we need to have that testing too. So we want to protect everybody, and this effort is our great, great priority since the beginning, and we're going to do everything we need to do to protect our seniors.
Mr. Legault, you started today to give a bit of hope to Quebecers, talking about restarting the economy. Is it a risky business to start doing this today, as we haven't reached yet the peak of the pandemic?
Yeah, I think it's important that managers, owners of different businesses, that they start thinking about a new way to work in the next weeks or months, but we hope in the next weeks. So I think it's important that I explain the criteria that we'll use in the next days and weeks about the 2 meters, about what do we do with the children of workers, what do we do with the collective transportation. So we have to change our way of dealing, of operating our companies. So I cannot do that alone. I have to have the input from the company. So that's why Pierre Fitzgibbon, Éric Girard, they are working with the representative of companies to see how we'll be able to reopen businesses if figures stay good in the next few days.
Samuel Pouliot, CTV News.
Hi. We just got a press release from the CIUS de l'Ouest de l'île de Montréal, and they say le service de prévention de contrôle des infections du CIUS et la DRSP ont décidé de ne pas faire de tests de dépistage à l'ensemble des résidents et ont plutôt opté pour un suivi serré des symptômes.
They did a very strict follow of the symptoms.
Good idea, and does it not go against what you just said about systematic testing of residents and staff in CHSLD?
Well, maybe Dr. Arruda will say something on that. This is something that we're implementing at this point, so we need to talk with the CIUS West de l'Île about that.
Okay. And today we learned that the Quebec government is buying 200,000 kits from Spartan Bioscience in Ottawa. How does the cost of these kits compare to traditional kits, and why will this method benefit Quebecers?
Oh, this is a great tool, and we're going to get them in a few weeks. And this is like you get the result in 30 minutes, and these are kits that you can bring on premises and in long-term facilities, for instance, in hospitals, and you test the staff, you test the patients. The benefits of that is great, so we hope to get them as soon as possible.
Thank you. So now questions sent by email. The first one is from Phil Autier, Montreal Gazette. For Madame McCann, can you give us example of what is being done to slow the spread of COVID-19 in seniors and long-term care centers besides sending in doctors and nurses? What is being done to concretely to protect people in centers where there are COVID-19 cases?
Well, to add staff is a very important measure because what it does is that it allows us to organize the long-term facility in a way where there's no contact between the zone where there are patients. It's already done, but to better organize the zones, the cold zones and the hot zones, meaning that you have staff that is completely devoted to each zone. You don't have staff that is going from one unit to another or even to one establishment to another. So that's what we want to do in long-term facility, to concentrate the teams, to dedicate them to a unit in particular and not to have people go from one unit to another. So this is a very important measure that we're doing. And also the testing that I've spoken about. We're going to test the patients and also the staff and the protective equipment that we're supplying as needed.
And now second question from Phil for Mr. Legault. People are so worried about family members and friends in long-term care and seniors residence. We are hearing about dozens of outbreaks on the island of Montreal. What do you say to people helplessly watching their loved ones sick or dying?
Yeah, well, I think we started taking precautions very early. A few weeks ago, at the beginning, we stopped the visits. Unfortunately, they had some visits before from their family, and some of the seniors were infected. So we're dealing now with the workers, the people, nurses, the doctors working in those centers. We are testing them to make sure that they don't infect. people living in these CHSLD or other places for seniors. But I think we expected that. I think we said it. Now 90% of the deaths are people of 70 years old and more. And of course, in CHSLD, people, they are already sick. So they are very vulnerable. But we're trying also to transfer some of the doctors and nurses coming from hospitals in those centers to help making sure that we control the situation.
And now the next question is from Raquel Fletcher, Global News. Why are patients from CHSLD in Montreal Nord being transferred to a hotel in Dorval? The patients suffer from Alzheimer's and moving them can be very disruptive. Family members want to know why not move hospital patients with light cases to hotels to free up beds instead.
I'm presuming this decision, and it's been discussed in the past. You remember probably that we mentioned that we had the 4,000 rooms, hotel rooms, to help us. And I presume, because I would have to double check, that the decision is to protect those people from from the situation of the COVID-19. Those people don't have symptoms or don't have the COVID-19. So to put them in a hotel in a protective way, away from other units in the long-term facilities who have COVID-19 is a move to protect them. That's what I presume has been done.
Thank you. And as a last question, can Mr. Legault or Minister McCann react to Jean Truchon pushing up his assisted suicide date? He was supposed to die in June, but was living in assisted living, having no family visit and frightened of COVID-19.
Now, maybe I'll start,
Yes, sure.
but just say that first, this guy had a lot of courage. Everybody in Quebec making tough decisions. Of course, we continue to study in which cases it would apply, and in respecting, of course, the will of the people, but putting also some parameters to make sure that there's no exaggeration or no special cases. Peut-être Danielle.
Well, I would say, like the Prime Minister, that our thoughts are with the family of Mr. Truchon and Madame Gladu. Played a very important role in l'aide médicale à mourir and the availability. And we continue, of course, to work in terms of giving l'aide médicale à mourir in the best way possible. So I salute Mr. Truchon. I salute him. And I hope that his passing away was in the most serene way. I really salute him.
Sur cette dernière question délicate, est-ce que c'est possible?
On this last delicate question, is it possible to repeat in French for our colleagues? Well, yes, I want to salute Mr. Truchon, the efforts that he made, the very courageous efforts that he made to create awareness in the Quebec population to assisted dying, medically assisted dying. I think that we must thank him for his work. I offer my condolences to all his family and loved ones. And I believe that we have to keep thinking about this. We must, in fact, allow certain people who wish to have medically assisted dying to have access to it, but we have to make sure that there's true consent, that there is no possible method of lessening suffering. So these important debates will keep taking place in our society. These are very delicate debates, but I wish to thank Mr. Truchon for his courage and the efforts that he deployed to have the Quebec society go forward with this debate. Well, listen, I wish to also reiterate what the Premier said. I offer my sympathies to Mr. Truchon's family. I salute Mr. Truchon as well, Madame Gladu, who were so important with everything having to do with medically assisted dying, and which can give the possibility to people who wish to, of course, have access to it. And as the Premier said, we continue with our work. What I, of course, wish is that everything happened as serenely as possible for Mr. Truchon, and I do salute him. This concludes our press conference. Thank you to everyone. See you tomorrow.